within the Jewish community, and hopefully to get news from very trusted sources, from friends and colleagues and congregants and people who are nearby, who are working in the most interesting arenas addressing all kinds of creative issues. And today, I think you'll find will be as outlandish and as creative as any of these sessions has been. So I want to say thank you to all of you so much for being with us, and particularly to Dr. Jonathan Graf, who is going to moderate this session. And I'll let you introduce our two amazing guests from the front line and the cutting edge. And I just want to acknowledge that there are so many other things going on in our society at the moment. As we were walking in here, John said to me, COVID in some ways almost seems like old news, and yet it's very much present and front and center. So I want us to kind of just leave behind the other complications of the world at this very moment and see if we can focus on one issue at a time, with the others to be discussed later. Please join us Friday night at 6 o'clock for other discussions. But for now, from the front lines of COVID-19.
Thank you, Jess. So it's a pleasure to be back with all of us again. This has been a very eventful past couple of weeks for a whole lot of reasons. But as we all, I think, should be well aware, the old news is still current news around here. And I can tell you, I'm working in the hospital now. I'm back on the hospital rotations. And there are plenty of COVID positive patients being admitted to the ICUs, being ventilated, being triaged in the emergency room. And it's a constant reminder, at least for me, that although we're opening up slowly as a society, that the pandemic itself is still very, very much around us. And so with that, we thought we'd turn our fourth installment of this particular series in a different direction. Rather than looking back at where we've come or examining where we are currently, we thought we'd look to the future. And in thinking about how we would address this particular program, we thought we would invite two of our very, very good friends and friends of this particular community as well, Stephen Schoenfeld and Dr. Daniel Kraft. Their bios are available in the mailings and emails that you guys have received announcing this program. So rather than reiterate what's in the bios, let me describe to you in my own terms how I view these two amazing people. First, Stephen Schoenfeld is the CEO of a company called BlueStar Indexes. He's has a lengthy track record in the financial field, particularly with regards to managing millions and billions of dollars of money that gets invested in index funds. As a matter of full disclosure, we know him well. Jessica and I are early investors in BlueStar Indexes as a company. We're not investors necessarily. We're not investors in the products of BlueStar. We are actually investors in the company, in part because we believe in Stephen. BlueStar originally was created with a patriotic purpose of supporting Israel from an economic side. And the idea was that BlueStar would create indexes that were capable of capturing the entirety of the Israeli economy, not just stocks that trade on Israeli stock exchanges, but the entirety of corporate Israel as represented and traded on exchanges around the world. And there was no real index that one could invest in easily with an American broker, let's say, or even if you were an Israeli pension fund. There was no one entity that would allow you to invest in the entirety of the Israeli economy in an index kind of way, until Stephen came in and with his mathematical genius created the BlueStar, the various indexes that BlueStar manages, including Israel and ITech and other ones that I won't get into. The reason he's here is because in order to do this, he has an intricate knowledge of the Israeli economy, in particular of Israeli tech, and in particular biomedical tech. He has to know these companies inside and out in order to be able to understand their appropriate weighting financially within the broader Israeli economy. And so we thought it would be a great idea to invite Stephen here, who's frequently gone back and forth up until the pandemic between Israel and the United States, to get his idea of what's going on in Israel right now with regards to the COVID pandemic, and how the Israeli economy in particular is responding and potentially could offer solutions to address and treat both the future of this pandemic and other pandemics that are likely to come around the bend. Dr. Daniel Kraft is also in our local circle of friends here. Daniel is also a very remarkable person. I remember Daniel as a graduate of Stanford University and the medical school, and fellowship and residency training, postgraduate training there as well. He is not only an accomplished physician, he's an oncologist by training, but he's an inventor. Remind me, Daniel, I don't remember the specifics, but you actually invented a new device that was able to do bone marrow biopsies in children, which is a particularly difficult, I think, procedure to do. Is that correct?
It's a device called the marrow miner. It's a way to minimally invasively harvest bone marrow for bone marrow transplants and stem cell therapy, not specifically for kids, but an easier way to donate bone marrow for a bone marrow transplant specifically, or for a wide variety of regenerative therapies.
So as you can tell, Daniel's a very creative person, looking at practical issues as they are in medicine, trying to figure out ways we can make medical care better, and coming up with an inventive way to actually create to leverage technology and a product to make the delivery of medical care better. And he's parlayed that expertise personally as an inventor and medical entrepreneur into a large enterprise known as FutureMed. He's the chair of medicine and neuroscience at Singularity University here. As I would put it, the chief goal of Singularity is to bring people of diverse backgrounds, not just medical backgrounds and not just scientific backgrounds, but engineering and other material sciences and even humanities, and bringing people together through a series of both learning sessions, conferences, podcasts, and cooperative relationships together, bringing people together to see if when you bring bright people together of all different backgrounds, can you basically change the future of medicine? And I will give several examples of where that's being applied with Daniel in particular to the COVID pandemic later on today. So those are our two guests. I hope I did you guys justice, as I know you personally as well. Let's get started with you, Stephen. Before we get into the future of the COVID pandemic, let's talk about the current, at least in Israel right now. The Israeli government and Israeli society approached the COVID pandemic a little bit differently than we did here in the United States and even others around the world. I think the Jewish state sees itself as a defender, the last great defender of the Jewish people, I think, around the world, as we are a very small percentage of the world population. And that includes all threats, whether they be threats from humans or threats from pandemics as well. And so talk to us a little bit about how the pandemic was dealt with in Israel and how it's affected the Israelis themselves.
So thank you, first of all, for the kind introduction. I was blushing. I could probably speak for hours about how Israel mobilized to combat the coronavirus, but I want to try to encapsulate it with a single thought, which is very much related to what BlueStar does. All of the elements that makes BlueStar so bullish on Israel's economy and Israel's tech ecosystem, all the things that we consider that give Israel its edge in technology, enabled Israel to successfully navigate the coronavirus crisis. And I'm using the word successfully intentionally. Of course, any death is a tragedy. Any Jewish death in Israel is a tragedy. But we'll go through the numbers in a second. But Israel had very firm, decisive steps by the government. There were plenty of debates within the government. It's the Jewish state, so of course there are a lot of debates, but decisive steps were taken. We can go over some of them. Israel also mobilized all of its national institutions to solve problems. The military, the academia, companies. Israel's a small society, a very resilient society, and you had incredible cooperation on a formal and informal basis to attack the problem. This involved on-the-fly inventions. This involved the IDF working with the Shin Bet, the internal security services, as well as the Mossad, both to do everything from tracking of population to procurement of PPE around the world. Israel was mobilized and unified. And if I could take one exception to a point you made, John, as much as Israel does see itself as a guardian of the Jewish people around the world, and right now is actually considering how it could help Jewish communities in Europe and the United States who are still on the back feet with the coronavirus. Israel's response toward its citizens was national. So it didn't matter if you were Jewish, Muslim.
That's right.
Israel mobilized, and it's really important for a bunch of societal reasons as well, which is beyond the scope of today's conversation, but I want to take this opportunity to mention it. Almost 20% of the working workforce in Israel's healthcare system is Arab. About 50% Christian, 50% Muslim, but Arab. They are the backbone in many hospitals, in many clinics. And there was never any hesitation on the Jewish side or the Arab side about what the goal was. There was enormous mobilization, even IDF troops going into Arab cities and villages, distributing food, distributing masks. This, I think, and I hope, will actually be a watershed within Israeli society. There's other changes around that. But it's very important to note that. Since I'm mentioning that, we all know the stories of how Israel has rescued Ethiopian Jews and Jews in Eastern Europe. The Israeli government, working with El Al and Israel and Arkia, working with the diplomatic corps and the Mossad, went to enormous lengths to repatriate Israelis. Most of you know that Israelis will travel all over the world after the army. They chartered flights, but more importantly, in countries like Peru, where the country was already locked down, they used diplomatic muscle to open the airport for El Al shuttle flights. And I think it's important, and it goes to the point of Israeli resilience. Back to what BlueStar does and back to the economics of it, we've seen Israeli tech and Israeli tech companies innovate in so many ways, in so many fields. But we've watched one after another, and then dozens, and then several dozens Israeli companies in every imaginable field pivot. Israel Aircraft Industries pivoted to building ventilators, just like Ford has started to do in the United States. Stratasys, which is a leading Israeli 3D printer, immediately went into overdrive to openly release the blueprint to 3D print face shields. You had a company, it's called BATM. They're in the tech field, but they're also in the diagnostics. They already had a test kit platform, and they quickly adopted it to be a test kit for coronavirus. And so we saw very rapid mobilization, and we saw decisiveness at the top. Now, Israel, the virus hit just as Israel was in a transition government. The elections had happened, but the new government had not been formed. So you could have had paralysis. You did have, whatever your politics are on other policies, the Prime Minister Netanyahu really mobilized his government. But the real heroes, the real players that helped Israel make the tough decisions were one rank below the ministers. It was the Director General of the Ministry of Health, Moshe Bar Siman-Tov, and the Director General of the Ministry of Finance, Shai Babad. They struggled. Shai Babad wanted to protect the economy. The Ministry of Health wanted to protect the health of the citizens. But the debate within the confines of the government helped Israel shut down the borders very quickly, shut down the airport and flights very quickly, except for repatriation flights, and then make the very difficult decision early on to shut down the economy. And they took enormous criticism, and yet they held their ground. And Israel, I've got to tell you just some of the statistics if they're not already known. Israel's performance relative to other countries is really something to celebrate, even if the word celebration is not appropriate for something like a lethal coronavirus. Israel, even though it's had another flare-up in this week as it started opening up schools, Israel has had less than 300 deaths for a population of a country of 9.2 million. To put that into comparison, my daughter's waving goodnight to me. Good night, Sarah. To put that into comparison, Austria, which also fared very well in the crisis, had 2 times as many deaths per capita. Sweden, 10 times as many. Belgium, which has about the same population, 34 times as many. And sadly, the UK, 100 times on a per capita basis, and the United States, 300 times. And so in absolute terms and in relative terms, Israel has fared really well. And Israel is reopening. Israel's reopening thoughtfully. It's opening carefully. I didn't mention this early on, but something that would have been a huge debate in the United States in any environment, the idea of tracking and tracing and the kind of civil rights versus freedom debate. There wasn't much of a debate in Israel. The government mobilized the Mossad and the Shin Bet, which are normally tracking for enemies, to track against the virus. And so that helped enforce the crackdown and the curfews. But also now that Israel's opening up and they've set the guidelines, the population knows that they're being watched. And that's good and bad, right? I mean, but in the most part, it's good. It's good because it affects people's behavior. If you know you're being watched, you're not likely to break restrictions. But also, if you have contact with someone who does have the virus or is later found to have the virus, the government will be able to inform you and and tell you to isolate. So I'm gonna, that's sort of the big picture. I know you have about 4 or 5 other questions. If I missed anything on this first round, John, just tell me, but I'm prepared to dive in deeper. Thanks.
That is a phenomenal point. I had other questions, but I actually want to deviate a second to get to something you talked about that just sort of struck me so profoundly. I was going to ask you about logistical issues and things like that. Who took over? The military? Is it the Shin Bet? Right. Is it the lay leaders? Whatever, the civilian leaders. But rather than get into those details, let me get a bigger sense for you and ask you how this has been managed to work. The countries that seem to do the best with the pandemic are authoritarian countries. Places like China can literally lock down a country, track citizens, detain people without cause. Citizens in China, I mentioned this on an earlier broadcast, are actually given ID cards, especially in the Wuhan area, that are color-coded and bar-coded, so that when they board trains and planes and try to get around the country, the government determines the risk level for that person and can limit where they can go and travel around the country. So very authoritarian countries. Even Singapore is a relatively authoritarian, top-down kind of government and places like that. It's very easy to close down a pandemic when you can control your people with like marionettes on strings. Israel, it's interesting, is a vibrant democracy, perhaps even more vibrant than in this country. And yet it seems like the people can accept authoritarian types of big brother. They're used to living in a culture where the Shin Bet is listening in on people, right? So how have the Israelis been able to reconcile their democracy and freedom with the necessity for the government to be paternalistic and authoritarian in ways that may limit their freedom, but may protect them, for example, from entering zones that are hotbeds for the pandemic?
So your question is a great one, and it's certainly going into this, no one could be sure how the Israeli population would have reacted. And, the old adage, you have 5 Jews and 7 opinions. In Israel, you probably have 17 opinions. And there was lots of griping as the restrictions were placed on. But Israel, for good or for bad, and this, as I said at the outset, this is part of Israel's strength in tech. Israel is very resilient. Israel has developed a world-class tech ecosystem amidst 7 different conflicts with Hezbollah and with Hamas and with the Palestinian Authority in the West Bank and with Iranian proxies in Syria. And so the population ultimately does trust their safety to the government. And that means almost all the population, where there was a slower adherence to the restrictions, was mostly in the ultra-Orthodox community and to a lesser extent, the Arab communities. But once they recognized the true existential nature of this threat, most of them came into compliance. Ironically, the Minister of Health, who this Director General worked under, was part of the ultra-Orthodox community. He ended up getting COVID-19 and was discredited. They weren't clear in messaging to the rabbis in the ultra-Orthodox community, and that's why they had outbreaks. Ultimately, Tzahal had to go into Bnei Barak and other Orthodox neighborhoods to enforce the lockdown. But the population recognizes and actually trusts the government, even a caretaker government. They very much trust the IDF. And also because it's such a vibrant democracy and the news and the media is so aggressive, all of the debates about the pros and cons of the lockdown were on the 9 o'clock news in Israel and in the next day's papers, and on the websites. So people saw the debate happening. They literally knew about the debate between Bar Simon Tov and Babad, and they understood the trade-offs. And again, regardless of your politics, I do have to give credit to Prime Minister Netanyahu, who we know when he speaks at the UN is very good at getting us worried about the Iranian threat. He did the same thing to the Israeli public. He did a national address, which unfortunately, again, regardless of your politics, our president did not. He did a national address early on in the crisis and said something very powerful. He said, do this for your grandparents. Do this for the founders of the state. Do this for the future by protecting your past. You're gonna miss your grandparents, but they'll appreciate it. And remember, there were holidays, right? You had national holidays and you had Pesach just at the time of the lockdown, right? Just after the lockdown. But he reinforced this. And the messaging from the top, in a democracy in particular, is critically important, and people got it. So I could keep going on, but I think I addressed the gist of your question.
Thanks, Stephen. Well, let me bring in Daniel here for a second. I know before we get started, you have a little mini slide deck to talk to us about. The gist here, Daniel, I guess before we get into your talk, is really to talk about the future of the COVID pandemic and how technology, medicine, Israeli tech, or whatever can leverage a lot of the available resources that are out here now to sort of create a new approach towards dealing with pandemics like this. So let me have you start with your little remarks as well, and then we'll come back.
Sure. Thanks. I love all the work coming out of Startup Nation. I've spent time there even as a medical student at Tel Shomer and Ichilov. And I thought to sort of kick off this part, I'd sort of start with maybe 5 minutes of some framing about what's happening in health and medicine and the future of medicine catalyzed by the pandemic, and some examples of Israeli companies and startups addressing that. So clearly a lot is going on. Technology has already been accelerating, and many of our fields have been disrupted, from how we do our banking to how we get our entertainment, and clearly COVID's disrupting many elements of our lives, and sometimes good and some bad ways. I love this slide. Who led the transformation of your company, the CEO, the CTO, or COVID? And COVID is certainly in some ways accelerating things. Part of the framing of, as you think about the future of healthcare, is it going to be in the standard four walls of the hospital? I keynoted a program in Sheba Hospital about a year and a half ago with CEOs of Stanford and Hopkins and others. And kind of our takeaway was the future of the hospital wasn't the hospital. We're going to increasingly go from a hospital to home to the homespital, in the sense of how we can leverage technologies, and particularly relevant in COVID, when a lot of monitoring and care can be done outside of the four walls. So how do we sort of reframe what we're thinking about in healthcare broadly, and how does COVID play a role? So part of it is shifting our sort of sick care mindset to more of a healthcare mindset. Our sick care model is sort of based on our old ways of doing things, getting intermittent data from your annual checkup, your blood pressure, your EKG, or even if you have hypertension or diabetes, you might be sending your numbers to your doctor if they even want to look at it by fax machine. And so that really leads to our reactive sick care system, where we wait for the patient to show up in the emergency room with a heart attack, stroke, advanced cancer, or a pandemic upon us. And I think big picture, a lot of the technologies that are here and that are coming together are converging to shift from being intermittent and reactive to much more continuous, real-time, personalized, proactive, and can start to bring care anytime, anywhere. And a lot of that is being enabled by this era of Internet of Things. 5G is here in many parts of the world. It does create massive amounts of data, whether it's from your genome or your medical record or your wearables. And the challenge is all that data is fine, but the challenge is to turn that into actionable information for you, your doctor, your healthcare system, and then to go from information to something that's actionable. So when John's in the clinic with, whether it's a rheumatologic patient or an infected patient, that he has best of time, just in time, crowdsourced information that doesn't take the usual 17 years to transmit. So there's real opportunities to accelerate these changes. And again, the incentives are shifting to go from hospital to home. Virtualized care has been up 1,000%. Many of you may have tried it and may not want to go back to your standard old doctor's visit. Care is starting to go to our minute clinics, our Walmart health hubs, and certainly telehealth. And a lot of that sort of exemplified and certainly been catalyzed a lot out of Israel in digital health, connected health, mobile health, whatever your favorite buzzword is. But the idea is that we can now collect data outside of the four walls, use that in an individualized way, and that the apps and services on top of that can be integrated, personalized to you. Hopefully you can still see my slides. Tell me if you can. And part of this is this new era of convergence. You know, it's not just digital and mobile, what's happening with AI, robotics, 3D printing, nanotech, low-cost genomics, and how do we combine forces? I'm leading up the X Prizes Pandemic Alliance Task Force. We have 60 plus organizations from UCI, UCSF to big companies like IBM to startups, thinking about how do we address COVID with the existing technologies. And there's 1,000 flowers blooming trying to solve for different challenges from testing to diagnostics to frontline capacity. So we're trying to pull those things together in interesting ways. Jonathan mentioned Singularity University, where I'm chair of medicine. I started a program there called Exponential Medicine now 9 years ago. And the idea is that we need to often cross-fertilize from different fields. That's where the sort of interesting things happen. And we've had many Israelis and others come over the last 9 years. If you have some extra time, go to exponentialmedicine.com. Under videos, there's some great lectures on the future of healthcare. So let's look at a few examples that are relevant to today. Clearly, wearables are playing a role in health and medicine. Just think, it was the Fitbit only launched 11 years ago. Now you can measure almost every element of your physiology and behavior from your wearable devices. Sometimes it's just simple small data, just your Fitbit, for example, if you've just had hip surgery, if you've gone home, can tell you if you're walking more or walking less. That can be a guide to how you're doing. And a simple example with orthopedics. And where we're going to head with all this is our digital exhaust is going to go from sort of quantified self data, siloed on our phones, and start to flow to our healthcare systems to be used much more proactively for optimizing health and wellness, for doing early diagnostics at stage 0, rather than stage 3 or stage 4, and then for therapy to make that real-time and feedback loop generated. And there's lots of new ways of digitizing everything from your blood pressure. An Israeli company called BioBeats was the first to get FDA clearance last fall on a way to do that seamlessly without a cuff. We're seeing new ways that you can have, here's a Bay Area company called Spire. These technologies are getting so small that I call them underwearables. You can put one in each of 10 pairs of underwear, it tracks your respiratory status. And now these are being used in remote patient monitoring to track folks who might have COVID and are having respiratory distress. Is it time for them to come to the hospital or not? So all sorts of new ways to collect information. An Israeli company called Beyond Verbal, now called Vocalis Health, can listen to your voice as a biomarker and has picked up signs of heart disease just by your voice alone. And now other groups are looking at the sound of your cough or your voice to help diagnose or triage someone. Is that a standard cold or a coronavirus or a croup? That can all be potentially done from the microphone on your phone. And then many other ways, I call them invisibles. Your Wi-Fi can be used to pick up vital signs of multiple people in the same room. Your camera on your smartphone can tell you whether you're touching your face or even potentially pick up your blood pressure and heart rate. So we're not going to need to wear anything in many cases. And so the challenge is all this new digital exhaust can be used in smart ways, potentially, if it can integrate into the workflow of the overwhelmed clinician to be a much more continuous, personalized flow of proactive data. And hopefully, again, be in the workflow. We don't yet always know what to do with this digital exhaust. Verily or Google Health here on the peninsula is doing the baseline trial where volunteers are sharing their digital exhaust, their genomics, their medical data, to understand what this information means in context. And I think where this is heading is we'll each have sort of our own personal check engine light, integrating like the many sensors in our cars, what's going on early before you blow a gasket.
Hey, Daniel, real quick, are you advancing your slides as you're going on?
I am. Hopefully I've been advancing this whole time.
No, people are just seeing the first slide here.
Oh, wow. I just stop share. I've been showing you all sorts of good stuff. You didn't tell me.
Oh, there we go. Now we can see them. Now we can see your slides.
I've been showing you all, but it says sharing is paused. Bring your shared window to the front. It is to the front, and you can't see any of that. That's really a shame. Wow. Well, I covered a lot of good stuff in pictures before all this. I was showing examples of wearables, like I'll have to do it manually here, I guess, because you can't see it when I hit play, apparently. That's really strange. I don't know how to explain that.
It is working now.
Huh? It's working now. All right. It only works when I don't share, I don't hit play. So I'll do it manually here. Sorry about that. I was showing examples of Israeli companies that can listen to your voice, Vocalis Health, ways that you might pick up your cough, Wi-Fi, being able to pick up vital signs, interesting ways that your camera can tell if you're touching your face. And, I was the example of checking.
Let's pause on those slides for just a second about the wearables. This is actually going on right now in the real world. I don't know if you could speak to it, but I can bring it up and maybe you might know something about it. South Korea has been hailed as a country that's been incredibly successful, I think, in its approach towards containing the pandemic. One of the ways it's been able to do so is through wearables. It's through actually apps on people's iPhones throughout the country that can actually track COVID hotspots within the country and alert people on their phones when they're entering an area with a high density of COVID diagnoses, because people are willing to share their health information freely along with their GPS on their phones, and the government's able to aggregate that and distribute it through this app that all Korean citizens have. Are you familiar with that, or?
Yeah, that's contact tracing sort of integrated with mobile, and now Google and Apple are doing that with what's called exposure notification. So based on low energy Bluetooth, if I was near Jonathan and he finds out he's COVID positive a day later, I might get a notification that I was nearby. Maybe I need to quarantine and get tested.
Yeah.
An Israeli company called Diagnostic Robotics has done a lot of work in the space with mobile devices and triage to Israelis, ask them questions so they could get hotspots. And be proactive and reactive instead of reactive, and also help understand who really needs to come to the emergency room or not. So that's another Israeli company doing work in that space. I think, bottom line, all these new connected devices are going to give us the ability to collect all sorts of data, make sense of that. And there's even studies now where your Fitbit or your Apple Watch can hopefully pick up that based on heart rate variability, temperature, sleep data, that you may be infected with COVID or have cardiac disease or others. So we'll be able to synthesize these in interesting new ways. And where it gets really interesting on sort of diagnostics and monitoring, we may be able to pick that up in a public health way just from sewage. If you do PCR for COVID in the sewage, you can tell a week before there are clinical symptoms in that neighborhood. Now, it's pretty intuitive, but a lot of COVID seems to be, some people just have GI symptoms, by the way, not always the cough and fever. So very interesting new ways to pick it up in a global way. And where this is going to sort of lead is, and catalyzed by COVID, is the whole sort of telehealth piece. The fact that we're going to have sort of, medical type tricorders in our home that can pick up lots of data and transmit that. Actually, an Israeli founder here in Menlo Park has a company called 19 Labs. They make this sort of quarantine at home kit where you can track your pulse oximetry, use a smart echo stethoscope, integrate, simple synthesis of data and share that with the clinician as you go forward. So we'll see a lot of these sort of devices. You can already buy some of them in an Israeli company called TytoCare. You can find them in the Best Buy today as an example of a kit that you can have at home that's going to augment your care. I don't think he's Israeli, but he's Jewish. Jonathan Rothberg is coming out with a home-based COVID detection kit, not FDA cleared yet, but this idea that we can now hopefully have cheap, low-cost home kits. We may be launching an X Prize for that in the next month. And other Israeli companies, I'm on the board of Healthy.io, is advancing this idea of a medical selfie. So instead of taking your urine in or your COVID test in to the lab, you do it at home, dip it at home, and your smartphone camera takes a picture of your urine dipstick, and then it does the diagnostics and sends that to your doctor and beyond. So lots of things are happening across diagnostics. The challenge is how to synthesize that as a clinician or as an individual. Artificial intelligence is playing a role. An Israeli company called Zebra Biomedical is a pioneer in AI and radiology. They're applying that to COVID, looking at chest x-rays, CT scans. We're seeing examples where you can use your smartphone to take a picture of the back of your eyeball, which is helpful for non-infectious and potentially infectious disease. And where this is sort of going to head into the future is the sort of ability for each of us to build a bit of a digital twin using machine learning, AI. We're all a bit different based on our genomics. Our risk for COVID is based on not just our age and comorbidities, but our genes, maybe our HLA types, et cetera. And then finally, on the therapeutic side, there's things that we're doing now that may be relevant before we have drugs, convalescent plasma, where folks who've had COVID can donate their plasma. Some seem to be super treaters and can treat sometimes dozens of COVID patients. Vaccines are clearly in the works. I think we might have a problem here in the US with an infodemic. Many folks, the anti-vaxxers, are going to be pushing against being vaccinated. And then we have all the sort of virtual telemedicine tools that are coming together, including for mental health, which is becoming more and more of an issue under the stress of COVID and the economy. And I'll give one final example. Just like with HIV, we may need to build together cocktails of drugs, particularly to prevent resistance. I've been building out a new company called Intellimedicine, where we're sort of 3D printing personalized pills, and those could be your cardiac medicines and your statin and your beta blocker, but eventually could be your personalized cocktail for COVID or other infectious diseases. So I'll probably stop there. I went too long. And I'll just close with the idea that discovery is part of that. We're still with a novel coronavirus. It's only been out for 6-7 months. So I think we'll all have an opportunity to be involved in clinical trials. Some of them can be done digitally. I think we'll end up with sort of a Waze. I like to call it a Waze for health, where just like we share our driving data to build a better health map, driving map, we'll have those for COVID as well, and health in general. And I was in Israel a year and a half ago and said, Ways for Healthcare, and I was introduced to one of the co-founders of Ways, and they're actually now doing a company exactly doing that, a Ways for Health. It's called StuffThatWorks.co. Try it out. If you have a condition from migraines to inflammatory bowel disease to arthritis, you can join a community of hundreds and donate and share what works for you. You'll learn from others, and that's crowdsourcing a bit of that future of health and medicine. So sorry for going long and not showing my slides, but that's some of what's happening that's being catalyzed by healthcare. If there's any silver lining, I think that's a lot of the energy, the collaborations, the new thinking, sometimes being pushed forward by COVID that'll end up hopefully saving a lot more lives that have been lost to this pandemic in the future.
Thank you very much, Daniel. So I'll go back and pull different pieces apart from what you talked about and sort of maybe draw them out a little bit for the audience here that I find very sophisticated, but may want a little more information about some of these very specific things that you sort of went into. So first of all, let me bring Stephen back in as well. Stephen, what knowledge do you have specifically of, so first of all, let's talk about the role of the government in Israel and private companies. Obviously, the Israeli government, like the American government, is very interested in helping speed along through financial help or expertise or whatever they could provide, speeding along the development of diagnostics, therapeutics, and contact tracing or whatever that the private sector may be very interested in developing products for. In Israel, how has that worked? Has it been the military, the government, and if so, what has the government thrown its weight behind in terms of the best and brightest candidates in terms of the Israeli economy? Are there certain companies making diagnostics? Are there therapeutics, whether it's antibodies to the virus or drugs for the virus or vaccines? Which Israeli companies are really shining here? What are some of the most promising products? And how has the government, where's the government put its nickel down, so to speak?
So your question is at least two parts. Let me address the first part first. The government is one piece of a sort of integrated approach to finding solutions. Israel's tech companies and tech ecosystem excels because our American notions of hierarchy are sort of broken at the beginning and stay broken. You have junior people advancing ideas straight up to the CEO. That same approach has applied. You have private companies working with government ministries. You have state enterprise. There are still in Israel certain, I'd call it the commanding heights of the military industrial complex is still controlled by the state for understandable national security reasons. So you have Israel Military Industries, you have Rafael Defense Systems, which is a designer of the Iron Dome. All of them have R&D facilities. All of them are very close to universities. So for example, Technion, which has produced more Israeli companies than any university in the country, has very close ties with the military and defense establishment. They've merged their research efforts, and the super high security around military efforts, they've kind of loosened those walls a little to fast track research. So you have public-private partnerships, universities, you have government-funded research institutes when we get to the vaccines. And John or Daniel, you could explain why this vaccine is promising, but there's a research center in the Northern Galilee that was already working on, I think it was for avian flu or bird flu, but they were already 4 years in, and so they've just got, added some accelerant. But I think what has worked in Israel is the fact that there haven't been silos, and as we've all learned on the downside in the United States, there really is a singular engaged health ministry. They also have a relatively efficient medical system. It's a sort of oligopoly of 3 health insurers, most of which have socialist roots, but they work because every single Israeli citizen has health insurance, and they all have ties with the different hospitals. And most of the hospitals have ties with the universities. So all the way down in the south, Soroka has ties with Ben Gurion University. And I mean, the best way I would describe it is what little walls existed were further broken down toward a solution. The other secret weapon that Israel has had, and I hinted at it before, is the Mossad and the Shin Bet got very involved and are still very involved. And also Israel has, just like the United States, top secret biological research labs. We don't like to think about biological weapons, but you need to understand biological weapons to understand antidotes. And Israel is very concerned about, it has neighbors who've actually used sarin gas on their citizens and have threatened it to Israel. So those labs were also deployed. And some announcements were made just before the last defense minister, Bennett, left his post. He took a little PR pitch to share some of what was discovered. In the specifics, and again, I'm gonna leave it, I'm intimidated by the two doctors on the panel, so I'm not gonna try to dive deeply. But you've had a lot of Israeli companies quickly pivot. I think many of you are familiar with the PillCam, which was developed by Given Imaging, which was a company in our index before it was acquired. Israelis excel at out-of-the-box thinking. The PillCam was designed by a missile technology, the idea of a camera in a missile, and how could you swallow it, right? So all of these out-of-the-box kind of solutions have been applied. I'm not going to claim to be an expert on which companies are doing what. I mentioned the research center in the Galilee called Migal. They've quickly privatized their vaccine patent capability, and they've already done a fundraising for it. So they're going to have plenty of capital for that. And I just think the results speak for themselves. Israel is in the process of emerging from the coronavirus and will be able to apply its lessons to help the entire world, while unfortunately here in the United States, we're still in the miasma of not knowing when we're going to emerge.
Let me give a great example of what you just talked about. You know, and so there was a question asked earlier this week from a congregant, and I will be able to take this question that was not relevant, I think, it's a very good question, but the conversation, and actually make this question relevant to exactly what we're talking about today. So this is courtesy of the Bladdises. I hope you guys, I haven't checked yet to see if you guys are on or not, but there was a fantastic question asked specifically about visiting a dentist. And this particular congregant is going to be visiting the dentist, and the dental clinic has said, you can't come here until you've had your antibodies checked and had viral testing and XYZ PDQ. Basically, you have to have like a vaccine card almost, like you would need to enter certain countries, like your yellow fever vaccination, right? They want to have some kind of proof of almost immunity, essentially, before he could come get a dental appointment. And he wanted to know what I thought about that and what were his options and where else could one go and all this kind of stuff. And so I'll just answer that in 1 second by basically saying that's a little extreme. We don't require my patients to come see me to do that. Obviously, a dentist is a high-risk procedure of aerosolized substances, and I can understand where they're coming from. I'm not so sure antibody testing necessarily would give me positive or negative, make me feel secure that I was the patient was or wasn't currently infected. But let me pivot that question instead to sort of say, like, I don't know if you guys are aware of the scientist at Ben Gurion University who has developed a breathalyzer test for COVID. And it basically will give a 1-minute readout in 1 minute about whether someone is infected or not with about 90% sensitivity and specificity. So the obvious need for a 1-minute readout would be you're coming to the doctor's clinic and you want a 1-minute readout. You're being screened to get on an airplane, right? All the practical things we think about, wanting to know in real time, is someone we're gonna meet right now infected, right? We don't wanna have to ask someone a couple days before, go get tested, get your results back in 24 or 48 hours, and then come meet me, right? It's not a practical thing to ask someone before boarding a plane or doing other things. And so this particular scientist, the Israelis have been outstanding, for example, in bomb detection. And one of the ways you detect the components of a bomb, right, is they wipe your hands and stuff, and then they put this little rag into a machine that's basically what we call a mass spectrometer, which will basically blast the compounds with radiation essentially into their component elements, right, and then you can get a tracing of what those elements look like, the molecular weights, and based upon a tracing, you get a fingerprint for the substances that are in that. On your hands or in some chemical that's being tested in real time. And that readout can come back in a minute. And this particular scientist said, why can't I blast if there's a coronavirus there, blast it into its components and get a molecular tracing for what the components are and match it like a fingerprint upon itself and trace this out of people's breath. And that can be done basically in a minute. So again, adapting, like you said, taking a technology that's essentially being used to detect chemical compounds, whether it be explosives or other components in real time, and applying the technology to actually detecting biological components. Are you familiar with this guy? Apparently, this is a test that's in large-scale clinical trials in Israel now, if I understand correctly.
So I don't know the specifics, but I mean,
you might know. Either one of you can
Dan, go ahead, Dan.
I'm not aware of that one
Yeah.
specifically, but it's certainly compelling. There are the idea of breath as a biomarker where you can pick up molecules that may be related to diabetes or lung cancer. And certainly that one sounds super promising. I mentioned briefly, we may be rolling out an X Prize in the next month for very rapid, cheap, accurate testing so that you can return to work or school under $5 a test. You can do it twice a week for antigen, not for antibodies. And that might be a potential competitor.
Centec Medical, if you want to look out for them, and it came out of university research and is now in the private sector. So these are fascinating things that are going on right now. So Daniel, can you speak a little? So you are there are lots of vaccine candidates that are out there. I've looked at there's the Oxford vaccine candidate that looks very, very promising. There are I have several friends working for various companies that have very, very promising candidates as well. But perhaps one of the most promising ones of all of these is a DNA vaccine candidate that you're very familiar with. You want to speak a little bit to that, and then I can also explain, if we need to the audience, what a DNA vaccine is and why it's so incredible to have the technology to be able to inject DNA, which degrades so easily even on your fingertips, because you have enzymes on your fingers that can digest DNA. Why it's so amazing that you can ingest not DNA complex into somebody and get actually an immune response to it.
I mean, I think we're familiar with the usual vaccine where it's made up of a component of the dead bacteria or virus. In the case of DNA vaccines, a friend of mine, an Aspen Health Innovation Fellow, Joseph Kim, is the CEO of a company out of San Diego and Philadelphia, where I think within within a week of the publication of the sequence of COVID out of China, they got an email with a sequence. They were able to figure out what was the DNA or the RNA coding for the spike element. You've seen the pretty pictures of the spikes, and code that into a DNA that would turn that into a protein, put that into a plasmid, and the vaccine that they're going forward with, and their invented phase 1 trials, essentially injects DNA, a little DNA gun, electroporation, pushes some DNA into your skin cells. DNA gets into your cells, and your cells as a factory start to make that little protein, the spike protein only, from that DNA that enters cells, and your body becomes the machine to make essentially the actual vaccine. So, and there are good examples of DNA vaccines that have gone through safety and efficacy in the past. So that's the promising approach. And another company you've heard in the news, Moderna, is doing an RNA type of version of that where they inject the RNA. So very interesting approaches that are moving pretty quickly. There still is some question about whether folks who've even been infected are going to still have a long-term protective immunity, or whether, and Tony Fauci raised this the other day, even if you are vaccinated, how long that may last. So lots of still unknowns.
Yeah, that's a good point. I covered that on an earlier program here about if you go back and look at the SARS pandemic from 15, 17 years ago, and you look at long-term immunity, it's not, at least humoral immunity, the ability to make antibodies to the virus is not there. If you look for cells that are called memory cells that live on long after someone has been infected and are capable of being called to arms very, very quickly upon re-challenge with the infection a second and a third time, which is why once you're immunized, you tend not to get sick the second or the third time. It's hard to find these memory cells in previously infected SARS patients, or find the levels of antibodies as well. There may be some cellular immunity, but not humoral immunity. So I think that's a very, very good point. And one of the reasons that DNA vaccine is so fascinating, theoretically, so first of all, I mean, having worked in the lab for many years myself, it's, to get DNA into a cell, to get a cell to take up DNA is not so easy. I mean, we used to have to do what's called electroporation, which is basically like, vibrate a cell into almost, till it's almost drunk so that it will take in a whole bunch of stuff through its cell membrane, including DNA, or you have to use a vector, either a virus or something else to transport a plasmid into, or a DNA into a cell. And then once it gets into a cell, the cell's machinery has to be able to translate it into RNA and then transcribe it into RNA and then translate it into protein. So it's technologically pretty amazing now that these companies have developed an ability to almost seamlessly allow DNA injected into you to get into your muscle cells or wherever that it's going to express the spike protein. But the beauty is that once it's in there, theoretically, you could have a perpetuating immune response, because the muscle cells will continue to express spike protein. There'll continue to be an immune response to that. It's not just a one-off injection. And theoretically, you can have a more sustained immune response, which is why this is such a promising candidate.
But the trick is, as you know, that we got to make sure that these proteins don't create an autoimmune response.
Right.
Or there's also some examples of the dengue vaccine where the vaccine actually accelerated a bad reaction in many folks who may have been infected. I think one of the interesting potential futures for health and medicine in general, we're going to have, here's my antique iPhone 2. You can sort of see here, and there's a company that has a little diagnostic device. This can do things like cholesterol and other things. But the hope is maybe in the future, we're all going to have our little home medical kits, which can be our medical tricorder and pull down our vitals, but also our little home viral diagnostic that you might just program differently for different RNA viruses. My friend, Larry Brilliant, a nice Jewish boy doctor as well, who helped eradicate smallpox in the 70s, calls this a practice pandemic because, while it's a horrible disease, the mortality and morbidity aren't 50% like SARS and others, like Ebola. So part of this accelerated future is we may have, again, home diagnostics that can be programmed for different viruses, and then accelerated vaccinations where you can quickly create a vaccine that matches the disease as we need it, and sort of email that over and have that printed at home.
And Stephen, you mentioned that Migal exactly is the Israeli government the defense ministry, I think, made an announcement a couple of weeks ago saying that there were incredibly promising early phase studies of this Galilee Research Institute vaccine, and sort of put it out there that they thought this could even be potentially done within the year. It sort of shocked the world. Tell us a little bit about what you know about that.
So it's actually two separate initiatives. Migal is a government-funded and private-funded research institute in the north of Israel. And their focus that has led to this development was chickens, was basically various coronaviruses that affect livestock. But because they were already well advanced in a study, they were able to very quickly pivot. I cannot explain the science of it, but it sounds very promising, and they sound very confident. You guys can decide how much to handicap it. But as I said, they created very quickly a private vehicle to commercialize the vaccine. They've raised a lot of money for it, so I think they're going to be well funded. And of course, I hope they succeed. What the defense ministry announced, and this was Bennett, literally in his last few weeks as defense minister, is the Israeli biolab, it has a much longer name, basically got the full sequence of the coronavirus. So I've got two doctors here, so you could explain what that breakthrough is. But basically they unlocked enough of it that they felt this was a path toward it. So it was two separate initiatives, but there's many others. Ben Gurion University and Soroka are working on things. I'm sure other major hospitals are also working on breakthroughs toward vaccines. That's all I got for you because I'm not a doctor.
It's pretty darn good, Stephen. I'm impressed. You're a jack of all trades in the financial world. There are many different therapeutics, of course, being developed too. I think there are many approaches to do this. UCSF just partnered with the Pasteur Institute and published, I think, a very landmark study in Nature this week, basically looking at basically taking the entire genome, as you pointed out, of unlocking the genome of the SARS-CoV-2 virus, translating all the potential proteins that are coded for in the genome as well, creating the three-dimensional molecular structures for what those proteins would look like, and then using a large computer database of all existing known safe for human consumption medical compounds, seeing which ones were potentially good binders to the various components of the SARS virus, and then using modeling to figure out what potential drugs that are out there. Haldol, for example, came across as one, might potentially be usable against the virus. To other folks who are developing novel therapeutics, whether it's repurposing old ones like remdesivir, or coming up with newer products that are specifically targeted to the way the virus, the biology of the virus itself, or whether it's antibody technology. I have a very, very close friend who's a high up at Eli Lilly, who has a very, very promising monoclonal antibody that's been developed that specifically will neutralize the virus itself. And this is a much more elegant way to sort of treat the virus, as opposed to using convalescent plasma that's being tried around the world, including in a trial published in JAMA, the Journal of the American Medical Association today, looking at the ability of convalescent plasma, people who've been infected with the virus and now make antibodies, just taking their plasma and using it to treat patients who are sick with the disease. So based upon all those technologies, Daniel, I'll throw it to you. Which ones do you think have the most promise for coming up with a potentially, I hate to use the word breakthrough or blockbuster treatment? And then back to Stephen as well. Are you aware of any activity at the corporate within Israel as well on the therapeutic side?
Well, I think there's no one silver bullet, even if we got a vaccine tomorrow. And I think it takes this whole continuum from early identification, including who's a super spreader, and identifying folks maybe from their digital exhaust or breath, and then quarantining, going back to our basic public health measures and sort of digitally upping the game there. I think part of our future, we might need, like there's a group in Israel called Hatzalah, they respond to emergencies on a motorcycle, to have a equivalent of volunteer EMTs for public health, who are trained in contact tracing and responding early, and can kind of do that at the neighborhood level. So that's a bit of a different topic. But I'm hoping we'll find effective drugs, and instead of like the remdesivirs, which we give to very sick patients, often intubated in the hospital, we'll find the equivalent of a Tamiflu that you take earlier in your course, even before you maybe even have symptoms, because you've got the molecular tests that you do from breath, and you take that at day -0 or day 1, and that really prevents you from being infectious, as well as tamps down any of the long-term sequelae, and this becomes, less morbid than even the common flu. So I think there's a lot of things emerging. The trick is going to be when we even have them, how do we pay for them? How do we make it equitable distribution? Who gets the first vaccines? But then more globally, how do we create this sort of learning engine that accelerates? How do you practice proning and taking care of very sick patients, to how do we take our lessons from our big data learning environment and catalyze that from Tel Aviv to San Francisco to Wuhan faster?
And proning, just so you guys want to know out there, we alluded to this a few sessions ago as well. Something as simple as whether you ventilate someone on a ventilator on their back, or whether you turn someone over on their stomach. That actually makes an enormous difference, it turns out, with this particular disease, in terms of the ability to get oxygen into people, and actually reduces the morbidity and mortality associated with this particular disease. So something as simple and low tech as that, like how you position a patient on or off a ventilator, to something as futuristic as a medical tricorder, applying diagnostic and therapeutic approaches. Stephen, any thoughts?
Yeah, so I just want to give a very real world example that's close to I'll say close to my lungs, because I had asthma as a kid. So an Israeli company that's public, it's one of the constituents of our tech index, as well as our broader index, is called Intercure. They've developed something called Respirate. It's a breathing device, but it's also helps people go into, I wouldn't say meditation, but breathing exercises. It was originally designed for blood pressure and to help lower blood pressure, but they're quickly pivoting to help COVID-19 patients with pneumonia-like symptoms. And it's just one example, a company in our index that is doing something very specific on the therapeutic side.
So with that, I guess we're coming close to our end time. Let me just sort of end with a summary from both of you, I guess, as I've sort of learned from this tremendously from both of you. Daniel, you've famously said on some of your podcasts that we've really approached the COVID-19 pandemic and other pandemics with sort of a 13th century approach, waiting for people to get sick and doing sort of very, very old-fashioned, old medical care, rather than sort of leveraging the tech and information that we're generating every day with even with our movements that our iPhones are generating passively, that could otherwise be leveraged to deliver the kind of information to allow society to control pandemics in a more modern, I think, kind of way. I think I've learned so much from you and your sort of approach to how we can use both tech today and the future of tech to sort of change the way we approach medical care and pandemics in the future. And Stephen, I've learned so much from you as well about the incredible Israeli ability to pivot. I think that's the real message here. It's the ability to pivot from the way you address a pandemic that's sort of upon you that you haven't prepared for, is to be as nimble on your feet as you can possibly be, to take your ingenuity and expertise in one field and recognize that it may have applications, if slightly modified, in a completely different direction. And I think I thank both of you for bringing those tremendous insights to us and our audience today. Thank you all very, very much. We've had a lot of people on the show today, and I'm sure they're very appreciative of you as well. And so with that, Jess?
I just want to add my tremendous thanks. I didn't introduce myself at the beginning, but I'm Rabbi Jessica Zimmerman Graf and the Senior Rabbi at Shereth Israel. And this has been a wonderful opportunity for us, as I said, to learn from community members and from people that we trust as the news and the world situation is sort of swirling around us. We're not exactly sure what the next steps are and where we'll get the best news from. So I think having people connected to us who are experts in the field and who are bringing us the most relevant information is so valuable. We're so grateful to you, Dr. Daniel Kraft, Stephen Schoenfeld, Dr. Jonathan Graf, for bringing us this conversation. All of these conversations are recorded. So if you're interested in listening to this again or sending someone to listen to this one or any of the previous ones, each one has been completely different and about a different aspect of the COVID-19 situation that we're facing. I want to thank all of you for being with us very much and invite everybody to join us Friday night at 6 o'clock as we continue to look at the world through a Jewish lens and build community. Thank you. Thank you.
Bye-bye.